I'd like to welcome everyone to our PACT Act webinar. We are thrilled to have you with us here today. I want to start by saying this event is being recorded, so if there's something you miss or you want to watch at a later date, we'll be sending you a link to the recording of this event after we wrap it up. Might take another day or two, but you should be getting that link in an email sent to you directly. My name is Scott Leese. I am a veteran and I work for the Veterans Health Administration. And like many of you, I had a lot of questions about VA healthcare and now about the new PACT Act. So let's see if we can answer some of those questions here today. Please realize that as a participant in this session, your microphone has been muted to minimize distracting background noises. That is all. We have quite a few participants on with us on this webinar today. I believe more than 200, which is why we're keeping everyone muted. Again, this is simply to ensure that there isn't any excess distracting background noises, dogs in the background barking or whatever you have. So we do want to hear from you. If you have a question or a concern, you can share it with the panelists anytime through the chat pane. You should be able to find that pane at the bottom of the right of your screen. Simply type in your question and we will do our very best to answer any questions you might have. We ask that you do not share any patient or privacy information because that we don't want to share that with the rest of the audience here. So if you wish to do so in detail, you can do that by reaching out to us after the webinar. We'll have all the contact information of how you can contact both the Veterans Benefit Administration and the VHA medical center near you to ask any particular questions you might have, especially about your patient care. For the sake of time, if we don't get to your question during this presentation, you can reach us by phone and email. And again, we'll be providing that information at the end of the presentation. Now, I'd like to introduce our panelist. Again, I'm Scott Leese. I am a public affairs specialist with the Veterans Health Administration. I am a veteran of more than 20 years with the United States Air Force, retired from the Air Force, and now working for the VA. Very, very happy to be part of a great organization that's here to serve our veterans. Also with us is Devin Wilgus. Devin, would you like to introduce yourself?
Yes, hi everyone. I've been with the VA for about 3 years, and before that, I was assigned to Congressman's office. I accepted a fellowship to be their veteran advocate, and I was able to get that role solely because I am an Air Force veteran and a service-connected veteran. So I have been serving my country in some form of capacity for almost 10 years, and I'm very happy, like Scott mentioned, to be on the team of, with the VA and specifically just serving the veterans and making sure you are aware of your benefits, because it is, as we'll dive into, it's very confusing at times. So that's why we're doing this, to make it easy for everyone, and just here to walk you through and navigate you through the VA healthcare system and the benefits system. So thank you for your time, and I'm happy to be here.
All right, thank you, Devin. Also with us is John Miles. He's with the Veterans Benefit Administration. John, can you put your mic and screen on and introduce yourself?
Yes, I can. I am John Miles from the VBA, and I do apologize. I'm a couple minutes late getting on. The WebEx program wouldn't give me audio at first, so I had to log in a few times. But I'm very happy to be here today to help out the veterans. I've been with the VA since 2011 in different roles. My job is to help navigate the system and give out information so our veterans can file claims and get what they're entitled to.
All right, thank you very much, John. First of all, what we'd like to do is explain a little bit about the Department of Veteran Affairs. A lot of people, a lot of veterans are not necessarily aware that the VA is not, well, it's an all-encompassing department of the government. It actually has 3 administrations. who, if you go to the VBA, for example, for your college tuition or a veteran home loan or some of the other benefits, that does not necessarily mean that you are enrolled in VH healthcare or enrolled with any services or benefits through the National Cemetery Administration. These are three separate administrations that fall under the Department of Veteran Affairs. And we just kind of want to make that clear to everybody, because there are a lot of folks who go in and say, hey, well, I've talked to the VA, so I must be enrolled in healthcare too because I got a home loan, or I even get compensation. And that's not necessarily the case. So we wanted to clarify that and make sure everybody's aware that there are three separate administrations. While we are all happy to serve you, sometimes it falls incumbent on the veteran to make sure that they are receiving their benefits by going to those separate administrations. It's the government. We're all familiar with that, right? We're all veterans, so it has its many layers sometimes. But we're here primarily to talk about the PACT Act. And this is some recent legislation that came out to take care of our veterans. It's named after Sergeant First Class Heath Robinson, and it's honoring our promise to address comprehensive toxins, or PACT Act. And you can find a wealth of information at www.va.gov/PACT. You're going to see that website presented here throughout this presentation. We want you to make certain that you're aware of that website, because while this is a quick overview, there's a lot of details that we don't necessarily have time to go into today, and we want to have that resource available there for you so you can go to that at any time and dig deeper into it. But the overview of the PACT Act basically is that it's expanded healthcare to a wide range of veterans that may not have been eligible before. And March 5th of this year, they actually opened it up and removed all the phases that they were going to phase this new legislation in. And it's really there to address toxic exposures. So it's giving our veterans an opportunity to ask for claims and benefits in relation to issues through toxic exposures. This is primarily targeted toward Vietnam, Gulf War, post 9/11 era veterans who were exposed to Agent Orange or burn pits, but not necessarily limited to. Again, this is a very broad and expansive legislation that's opened up healthcare and benefits to veterans. And again, we really encourage you, if you want to really dive deep into it, go to www.va.gov/PACT or some of the other resources we're going to refer you to here shortly. Again, this is expanding healthcare and eligibility to veterans from the Vietnam, Gulf War, post 9/11 era veterans with more than 20 presumptive conditions. And we're going to talk a lot about what a presumptive condition is and what a presumptive exposure location is. And that this is actually giving veterans the opportunity to get that toxic exposure screening to see if they actually qualify for health care and additional benefits. So what does a presumptive condition mean? I'm not going to read this slide, but basically what I'm going to tell you is that for those of you who are familiar with the VA, if you had a condition or were going to file a claim, you had to prove that whatever your disability was acquired through service in the military. Now it is presumed, if you have certain conditions, it is presumed that if you did the service in a certain window, in a certain theater, it's presumed that you are now, you've contracted that and now eligible for health care, as opposed to having to go back and prove it. It's already presumed. There isn't that process of qualifying. And who's eligible? Again, we've talked a little bit about this, but it's not just Vietnam, Gulf War, post 9/11 era veterans. There are other folks out there that have been in the global war of terror, global war on terror, and in other theaters of condition, in conditions that weren't necessarily around the burn pits, just that you were in the military zones and exposed to toxins that were in the air. Also, there's some other hazards, some nuclear hazards and some other toxins, some radiation, fire, sulfur, et cetera, that all might be part of the PACT Act. So something you should know while we're talking right now primarily about healthcare, there are VBA benefits as well for compensation and filing claims there. But if you don't qualify for healthcare for some reason under the PACT Act, you should still look into seeing whether or not you qualify another way for VA healthcare. And you can go to www.va.gov/health-care-how to apply. And there you can actually apply online and learn more about what it is to get VA healthcare and benefits through the VHA. You have two great campuses in the Northern Indiana area, one being in Marion and the other in Fort Wayne. We've got their contact information here. Again, don't feel like you need to write this down because we're going to be sharing this video with you later, so you'll have that contact information. Additionally, there are 6 community-based outpatient clinics, or CBOCs, in the area for convenience, so you don't have to go right to Marion or Fort Wayne. There are other locations in the Northern Indiana area. So now I'm going to actually turn it over to John to talk more about benefits and services through the Veterans Benefit Administration.
That sounds good. I'm going to go ahead and read the slides for everybody, and then I'm going to interject and add a little bit of information. I'll warn ahead of time, it is a little bit of information overload, but it's good information, and you will have the recording. Sorry about that. There, I'm up on the screen now. For as far as compensation, to explain to people, veterans, everybody's at a different level. Some have filed claims in the past, some haven't. Some have filed and been denied. A couple things we want to look at for you get disability ratings from 0 to 100%. And what that says is, if a veteran files a claim, say you're on a ruck march and you injure your ankle, you fracture your ankle, you're still having pain today. They call that the nexus. That's why you would want to file a claim. If it's PTSD, for example, if you've been sent over with the Gulf War or anything over to combat, just by the nature of combat, it's presumed you feared for your life because they're firing weapons at you and you're in a combat zone. The reason you do a compensation claim is you want them to do an exam. It's the examiner's job to say, yes, this is because of something that happened in service. And the reason they do an exam is for current severity. For lack of a better terms, the more symptoms a condition has, the more severe it is, the more it would pay potentially. So that's why they do current severity, just like they talked about the presumptive conditions. For example, a Vietnam Agent Orange veteran that has diabetes, that's a presumptive. And you're like, well, why would we send me for an exam? Because we've already been diagnosed with diabetes. They'll check your lab work and see how severe it is to make sure they're rating and paying you accordingly, so you'll get what you're entitled to. The raters their job isn't to do no's. We have rules and parameters. If they say it's from service, it's the rater's job to make sure you're getting what you're entitled to. Money doesn't fix the problem, but when you sign the bottom line, it sure helps if you're owed something. Important to know on this slide, if you do a claim and you hit the rating at 30% or higher, you want to add, if you're married, a spouse for a dependent, because that gives you a little bump in pay. If you have children under the age of 18, you can add them to it. The VA also covers if they go to full-time college between the ages of 18 to 23, that gives you a little bump in pay also if you're over 30%. And like it says on the slide, everybody likes the bottom one. Compensation's tax-free. That helps a lot. You sign the bottom line, most definitely. Disability claims, a two-step process. Basically explaining the process right now. Understand if you file a claim, and don't hold me to a time, our average claim process is averaging 4 to 6 months right now. That's with all the steps involved. It is a two-step process, but basically you file a claim, a VSR looks at it, they order your military records. Depending on what years you served during, they're either available on the computer and they'll usually get them back after they ask for them within a week, or they might be in a warehouse in St. Louis. Same thing, they ask for them, they're sent over in the computer and they scan them in and they put them in. The reason we do the military records is that's the evidence we need. If you say you rolled your ankle and went to medical on a ruck march, then we have that evidence. Not that we don't believe you, it just substantiates your claim and they can see how bad it was injured then and make their best opinion today. The degree of disability, exactly what we said. How severe is it? If you did do an ankle, they would do range of motion, things like that. Service-connected disabilities are treated at the VHA. In other words, regardless of your insurance, lack of it, or what you have, if you're service-connected for a condition, your treatment is covered at the VA with no copays or cost sharing or deductibles on medications. So that can be a potential savings. Now, how to apply for VA benefits? There's a few ways you can do that. If it's a claim that you've never claimed before, a condition, you would want the 526 Echo Zebra form. That's for disability claims. If you're filing it for pension, it's the 527 Echo Zebra. If you're filing DIC, which would be death pension, that would be like for a surviving spouse. If a veteran were to pass and the surviving spouse was filing to see if she was eligible for DIC or he, you would fill out that form. There's a couple ways to fill out forms and do claims. You can get a service officer, which is a free service to you as a veteran. It's organizations like the American Legion, the DAV, the VFW, the Paralyzed Veterans of America. The list goes on and on. Their job is to help navigate the system. The good news about that is when you do a claim, you're going to get letters from us along the process. They're form letters, a lot of them. The first paragraph tells you what's going on and what exactly where we're at in the claim, what we're doing, what we need, what we've done, where we're at. The rest of it is just legal speak that needs to be there. Some of it confuses veterans. When you have a service officer for you, they can translate the letters. You take their business card and call and say, hey, I got a letter. Are we good to go? Do I need to fill out a form? Do I need to do anything? And they can let you know. We don't work against the service officers. We work with them. And a lot of your local VA facilities have service officers in there. It's a completely free service to you. I always recommend it because it puts another set of eyes in the process. And that's not a bad thing. So at your local VA, next time you're there, if you don't have one, you just say, hey, I'd like to sign up with a service officer. They'll point you in the direction where you're at. If you don't want to use a service officer, it's not mandatory. You can go on the va.gov site that they spoke about. You can file a claim. You can get information. You can file the claim right on there, and it puts the form right in. Basically, you set up an account. It does a verify me. It sends a little information to your cell phone because we want to protect veterans' information. Then it creates an account for you. Then it's a lot of information, but it's very simple. It's like, what do you want to do? File a claim. Then it says, have you filed a claim for this before? And what it's doing is the computer is picking out the form for you to make sure you're filling it out right. Nothing worse than filling out a claim, putting it on the wrong form. Then all of a sudden, after you file, a week later, you get a letter, hey, it's the wrong form, here's the right form. Then you have to fill it out, then you have to turn it in. It's not the end of the world, but it holds up your claim when you already know that you're at a 4 to 6 month potential time frame, more or less, depending on how quick we get the records and the procedure works. But what I always tell veterans, so it eases their mind, if you don't file a claim, your answer is always no. When you file a claim, you move to maybe. We don't have a quota on no's. It's the rules and what they say. So when you're at the maybe, if they're still looking, you're not at a no. You're still at maybe. So even though it gets stressful waiting, you want to do, do your process. If they send you a letter and need something, send it back timely. Doesn't mean you need to spend money to overnight any evidence or anything that's not necessary. Now, also, while I'm mentioning it, the VA has an awesome system. It's not advertised very well because not all veterans listen to the classic rock radio station. Not all veterans listen to the country station. Not all veterans watch CNN. Well, they have a system. It's called Vera, VERA. If you Google in the computer Vera Veteran and you're wanting to file a claim on your own, or you have a question on the status of your claim, that's what I do all day. Depending on your state, when you go Vera Veteran and Google it, it brings it up. You click on it. It takes about 2 minutes to make an appointment. You can make an appointment at your local regional office in person, which isn't necessary, or you calls it a virtual appointment. It's a phone appointment, but it's not virtual like this. It's just a regular phone call. So in other words, you're like, hey, I'm wondering where my claim's at. I did my exams. I haven't heard nothing for a month or two. What's going on? You go to Vera Veteran, you make the appointment, put in name, last four of SOS, address, phone number. It gives you the available times. Pretend you pick tomorrow at 9 a.m. Around 9 a.m., your local regional office, right around there, give or take 5 minutes, is going to call you and say, hi, I'm so-and-so from your regional office. They'll verify you by your SOS, date of birth. They'll read you a statement so you know they're not a telemarketer selling you a used car warranty. And then they'll answer your questions. Because if you go on the va.gov site, the update is always generic, waiting for rating, claim open. The computer doesn't know you're waiting for exams to come back. You're waiting to get the exams done. So that's a good system for there also to use. Applying for the benefits, like they said. Also, this last slide, this one's my favorite. 1-800-827-1000. When you get this recording later, you write that number down. That is the Veterans Benefit Administration call center. They are open 8 a.m. to 9 p.m. Eastern Standard Time. They are a one-stop shop center for everything. Hey, am I eligible for a VA home loan? I don't know, looking at your file. I don't do home loans. I do compensation claims. They will put you to the right 800 number or right department, and you can ask, are you eligible for VA life insurance? Yes, they do offer it, and it's very, very reasonable if you're eligible. They can point you to the direction that, hey, education for my kids, am I eligible, or what's the process? Same thing. Nobody knows everything, but they will point you in the right direction. That number is invaluable. If you say, hey, John, I don't do computers. I can't make one of those Vera appointments. Guess what? I got you. You call the 800 number and say, hey, I want to make one of those phone appointments so someone can call me and tell me about my claim. Guess what they'll do on the 800 number? They'll take your information. They will make the appointment for you in less than 5 minutes once you're on the phone. Then someone will call you. They'll answer your questions, and you're good to go. So that's a very good resource. If you're watching the video or do have a pen, the 800-827-1000, I would write that down. Very, very helpful. There's over 400 employees there answering calls and questions throughout the day, last I heard. They do a very good job. If you call later in the day, the busier they get. You might be on hold a minute, but you'll get the information you need. So other than that, I believe that is my last slide. We will turn that back to Devin for any questions, I believe.
Yes. So yeah, just a couple more slides here. Well, actually, there's contact slides later on, but so we'll go ahead and turn this over to Devin. Devin, do we have any questions in the queue right now?
No, we do not have any questions at the moment, but please, that's why we're here. We want to clarify and answer and help in any way that we can. So there is a Q&A in this webinar software, and you can just fire your questions in there, and then we will answer them. So well, of course.
Absolutely. So I'd like to piggyback a little bit on what John was talking about. Yes, there's a wealth of resources out there. If you can definitely call the 800 number, which I'll go back to here real quick. This 800 number for VA, but also rely on your local county VSOs, your veteran service officers. They are a fantastic resource because they become an advocate for you in many ways. As John said before, they help navigate you through this process. whether that is filing a claim for compensation or a service connected disability rating, or assisting in helping file for VHA healthcare. So we highly recommend that you go to them as well to help navigate the system, because as I said very early on in this presentation, a lot of folks don't always realize not just all the benefits that are available to them, but the different agencies that you have to go to apply for those benefits. It's not necessarily all inclusive. The VA is looking at that and looking at better ways to handle this, but currently it's still somewhat disjointed. So again, it's incumbent on the veteran to some degree to go out and seek their benefits and apply for those benefits. So we highly encourage you to, again, call the 800 number or go to your veteran service office in the county buildings, and also just go to www.va.gov. There's a wealth of information out there about what's available to you as veterans.
Scott, I've also got one thing I can add if we're waiting for questions. I forgot it's a kind of a new thing, and I'd like to share it with veterans.
Yeah, please do. We do have a question in the queue, so go ahead and finish that so you don't forget again.
Sure.
And then we'll dive into that question.
Okay. So as far as the toxic exposure, we talked about Southwest Asia veterans, ones that served over in the sand, Agent Orange Vietnam veterans, Camp Lejeune water veterans. Say you're a veteran and you believe you were exposed to something and you weren't in one of those locations. The VA has a brand new, well, not brand new, but it's relatively new thing called toxic exposure screening. Your local VAs do that. Each hospital and clinic has a different procedure and person that does it. So say, for example, you're in the Navy and you were trained for firefighting on the ship, because at least a quarter of the ship is trained, because if you're in the middle of the ocean and the ship catches fire, you got to get it out. Well, you could potentially be exposed to the firefighting foam, the PFAS. And if you think you're having skin conditions or respiratory because of that, you can contact your local VA and tell them you would like a toxic exposure screening. It's completely free to you. Each VA has a little different process. I've talked to a few VAs. Some have your primary care doctor do the screening. Some have a nurse do that. They will help you. It's a 4-part system. The first part being a phone interview. The second part, if necessary, is blood work. It's completely free for you. Now, a lot of veterans are like, no, I'll pass on the needles. Not everybody gets blood work. But when they get done with the 4 steps and they think there's a chance you were exposed to something, they will actually help you file a claim if necessary. Like, say, the mechanics in the Army, the heavy wheeled vehicle mechanics, they are exposed to degreasers, hydraulic fluids, diesel fumes, and all that. If you think it could potentially be from that, get the exposure screening and don't leave anything on the table. It's important to know. They also take that data, and that will help your fellow veteran in the future, because if they've got 10 tank mechanics, and don't hold me to the number, and they find that they all have respiratory issues and they were all around these solvents, that might be able to help your fellow veteran for the future, where they might change procedures or what have you if possible. So just wanted to share that.
And help identify those presumptive conditions. That's basically what it's doing. It's like, okay, we don't need to have this discussion. We know now that you were exposed to this, so it's presumed if you have this condition, it was acquired through your military service.
Yep.
So absolutely, John, you are spot on there. That
I'm glad
you share that information.
Yes, sir.
Yes, thank you, John. And that might have helped answer this veteran's question, but I'll read it out here and make sure that we're good to go. This question is from Kellen. I was exposed to burning generators inside of my aircraft. I inhaled smoke and other toxins for upwards of 25 minutes. Would this exposure be covered through the PACT Act? I've already received my disability decision.
Okay, to answer that, if you claim something from the PACT Act, I'm glad that that question came up. You never claim a condition PACT Act. You have to claim a condition like shortness of breath, respiratory issues, wheezing, sinuses, allergies. Even if it's not on the presumptive list, exactly what we just spoke about, you could go through the toxic screening so they have the data. If you're already service connected for it, it may not change the rating, but again, that could potentially, if it's a respiratory issue, skin issue, something like that, you want to go through the toxic screening. It could help a potential veteran in the future. It can help for the presumptives. And also you'll know, because again, if they do blood work or anything, they'll have you on the toxic screening registry. And hopefully nothing else comes up in the future, but that might help out with that too if you're already done. So I would definitely go with the toxic screening. If you're already service connected for it, it's it. And like I said, I can't say it enough. It doesn't have to be the standard, hey, you only serve stateside. If you were in the motor pool and you breathe a lot of diesel fumes and you think that might be the problem, file it. No one's going to call bull on it. They're going to let the VA go through the procedure and see. And if there's anything you're entitled to, most definitely you'll want to know. If you don't file, the answer is always no.
Yes. That's a great point, John. And I think probably what I didn't actually delve into enough was what a presumptive condition is, other than say, okay, it's presumed that you acquired that through military service. There's a list of presumptive conditions that is quite extensive. Again, if you go to www.va.gov/PACT, you'll find that list there. And they are conditions as varied as hypertension, high blood pressure. A lot of people have high blood pressure, and hypertension is one of those presumed conditions or presumptive conditions that if you have that and you served in the military in a certain theater of operation within a certain window, it's presumed that your hypertension is in relation to that service and then qualifies you for health care and benefits through the VA. So I don't want to go through the entire list because it's very extensive of the presumed conditions. That's why I highly encourage you to go to va.gov/PACT to look at those. But again, as John was saying, if you have a condition that isn't on the list of presumptive conditions, you still want to bring those symptoms to a VA medical center and say, hey, I want a toxic exposure screening, or hey, I think that this condition is in relation to my military service because again, I rolled my foot or I hurt my back or I did whatever, and I've had this issue ever since I left the military, and you just maybe never filed a claim to begin with. If you go to a facility and you talk to compensation and pension, and work with the VSO, they can help you get that disability rating and get you the care and benefits and compensation you deserve.
Also with that, if we don't have another question right now, and another thing I didn't touch on, if you've been denied a condition before, and whether it's a presumptive or not, and it was denied before August 10th, 2022, say you had a respiratory condition, it was denied, and it was prior to August 10th, 2022. Now, under PACT Act, you want to have it reconsidered. You want to file what we call a supplemental claim or an appeal, even if it's on the presumptive list or not. And you're hard if you think, hey, it's because I was exposed to the burn pits and this is what happened, or I have a skin rash or what have you. File an appeal with that. It's a VA form 20-0995. Let them relook at it with the new information. It may come out favorable for you. Either way, it's good to know, because if you don't appeal it, you're not going to know. So that's another important thing. I'm glad you kind of touched on that.
Absolutely, John. Thank you for bringing that up. Still, that was our only question. I'm, and really, really encouraging you, if you guys have any additional questions about anything about the VA, we can either answer that or, get you in contact and point you in the right direction to do that. So.
Absolutely. Since we've got the time, I'll go ahead and actually share my personal experience. As I said before, I was in the Air Force for 20 years. I was in public affairs. I have to say, I think the worst I ever really had was a paper cut. I was not in direct combat. I was in combat support several times, but I never felt like my life was threatened. I never lost a limb or my sight or anything like that. But shortly after I retired, I had a respiratory condition that put me in the hospital uh, twice, and put me on prednisone for an extended period of time and on oxygen for more than 6 months both times. And nobody could diagnose it. The doctors said, so do you work on a bird farm? Do you work around chemicals? I said, no, I work in an office. I got it pretty plush. I'm not exposed to any toxins or anything. Um, I found out after this PACT Act came out that actually, yes, I was exposed to toxins just by being in the theater in Bahrain and Abu Dhabi, uh, and it's just that the toxins are in the air, and that I consequently had um, a condition that has actually impacted me greatly. It's actually caused pneumonitis a couple of times and scarred my lungs. And now I have a disability rating that I never thought I would have had because, again, I worked in an office and was not in direct combat. So this is something that is expanding healthcare, not just to more than 5 million veterans, but to people who may not even be aware that this opportunity is available to them, or that they may not know it in the future, or may not know it now, but will find out in the future that all of a sudden they have this condition that they can't fathom where it's coming from, what the source is, and it might be due to your military service to exposure to toxins and so forth. So this is one of the reasons we do this webinar, to help educate folks like yourselves. But we also hope that you share this information with fellow veterans. You might have that conversation with a friend of yours who might be suffering from something, and you might say, well, hey, I just learned about this PACT Act, and you might want to investigate this and see if this isn't something that is something you want to look into. So let's go ahead and go back to
We do have another question, and Scott, thank you for sharing that story, because that really does touch base and help a lot of veterans. All right, question from Chris. I filled out the initial screening for toxic exposure. Does the toxic exposure screen in person, is it different than just the online screening?
Yes, the online screening is different. That's like the first step. If you go to the va.gov site, if you don't call your local VA, it's the MyVA 411 is the phone number. It tells you on there. You want to call the number, they'll point you to your nearest VA. Some people that live out that might be near a CBOC, not from what I've heard, not all CBOCs are staffed to do that. It might be whatever local VA is attached to it. It is a 4-part one. Like I say, the first one starts with the phone interview, asking questions. Part 2 with the blood work, like I say, it's very, very small percentage of veterans get the blood work done. But if it needs to be done, why not? Just so you make sure, because again, their job, there's no quota at the VA to throw it under the rug and say, oh, it didn't happen. Their job is to say, okay, you might have potentially been exposed to something. Let's do a claim. Let's see if it is. And again, it's just very important in so many different ways.
and those toxic exposure screenings are going to be determined by what your symptoms are, what your presumed conditions are. That if you have these symptoms, then it might just be a phone interview or a visit with the doc. If you have something more extensive, it might go to blood work, it might go to other testing. Whether it's like I had to go through pulmonary testing, I had to go in the booth and breathe until I thought I was going to pass out, kind of thing. It got very extensive for me. But that's dependent on what your conditions are, as to what level of screening you're going to have to go through, which is all going to help determine that disability rating.
Yes. Chris, thank you for that question. And just to give the confirmation or just reiterate, please, I know you filled out the online one, but follow up with your local VA.
Yes.
I know I might be preaching to the choir, but be proactive. The VA is very, very big. So that screening might be sitting at a national level, or who knows. So just call them up, let them know that you did the online one, and maybe they can either pull that from somewhere or just get you in the door to take care of it that way. But don't wait around. Definitely don't wait around. Definitely contact your local VA.
Yes.
And those numbers are right there on the screen for you. And to that point, other contact information for the VBA, we've got the 800 number. Again, go to www.va.gov. And you can also contact John Miles at this information. We've got the 1-800 number for the PACT Act. And again, go to www.va.gov/PACT. There is a wealth of information on there. And please share this information with your fellow veterans. Again, we're sending this link of the video for this webinar to you. Feel free to share that with anyone else you might feel would benefit from learning more about the PACT Act and watching this webinar. Devin, did we have any more questions?
No, this is last call. Get those questions in now. We're wrapping up here, but again, we'll stay on as long as we need to. Yes, no more questions on my end.
And so, John, I'll turn it back to you for a second, see if there's anything else you wanted to add here.
Yeah, I'd like to add that anybody watching the video or anything, you have my VA email address. If you have questions or even doubts, please ask. There is no dumb question. Understand, I do veteran outreaches though. If you email me, put in your name. Hi, I'm Fred Smith. Please call me at 555-555-5555. When you have time, I have a question. That's all I need. And when I see the email, I will call you. Sometimes I'm on veteran outreaches. Besides doing this on video, I'm out in person. I may not get it for a day. Understand, I will answer you. And I'll either answer you to the best I can or point you in the right direction. But please utilize my email. We don't want any veteran leaving anything on the table for any reason.
Absolutely.
All right. Well, thank you very much for joining us, gentlemen. And thank you all veterans for taking the time to learn more about the PACT Act. And again, we'll be sending this video to you here in the next day or two. I just want to say thanks again for joining us, and thanks for your service from a grateful nation.
Thank you, everyone.
Thank you.